Hi, everyone. I thought we would be introduced, but we're not. So I'm Michael Specter. I write about synthetic biology and the merger of information technology and the biological world for The New Yorker. And this is why you're here. Renee Wegrzyn is the head of arpa-h, a new and amazing government agency that wants to disperse money to make health problems disappear. And am I echoing? Yeah.
Yes.
Before I even ask a question,
We'll switch to that.
we're going to down-regulate me to a handheld mic, which is probably where I should have started. So before I even ask the first question, I just want to make a comment based on a conversation that Renee and I had last week when I was asking her, like, what is the scope of arpa-h? And she said, well, I don't want people to give me these nickel and dime proposals. And I said, what do you mean? And she replied, $100 million proposals are cute, but I'm looking for something substantial. So when a federal health official says that to you, you better listen. So my first question is, how would you actually describe what you're doing? What's the mission of this new organization? And a lot of us have heard of DARPA. We know you were there. Is it a health version? Is it different?
Yeah, so our mission at arpa-h is to accelerate better health outcomes for everyone, period. And so health outcomes is how we're going to measure our progress. This is really what investments can arpa-h make? We're only an investments agency. We're not, bricks and mortar labs. But what can our funding accelerate to actually improve people's lives and standard of care? So you should think of arpa-h as a place where there'll be transactions as part of the health ecosystem to create a little spark. And so, DARPA was launched in response to Sputnik. We don't have a specific Sputnik moment for arpa-h, but it's really this energy around innovation like you're hearing about today, but also this urgency around crises in health, whether it's a pandemic or climate crisis that are making this more and more frequent. And so that's the urgency by which we're trying to achieve these goals. And I know we'll talk a little bit about the model and how we're going to pursue that.
How does it actually work? Like your approach to risk-taking, is it like DARPA? Is it completely different? Do you approach problems in the way that we're used to funders approaching them?
Yeah, I think when you think about arpa-h, it's important when you talk about risk that we're not taking on risk to the patient or safety risk. It's risk in terms of technological risk. And so our approach is to make sure that we're funding projects at the level where we know you're well-resourced, you have all the capital equipment that you need to do the job, you have the team in place, and the funds will help you buy down execution risk, and so that you can really only focus on that technical risk. Some of the ways that we can approach that, I've only been there for 6 months, by the way, so we're still standing up the organization, but part of that was working with the Congress to make sure that we had authorities in place that we could be uncompromising on so we could take risks. Some of those include things like exempting us from some NIH policies, not things like ethics or safety, but study section. We don't make decisions through a study section. Our program managers are the sole decision makers. So by allowing a person to be the decision maker, you can take on some of that risk. Our budget is small. It's only $2.5 billion. When you compare to HHS, which is more than $1.7 trillion, it's a very special place for us to be focused on those high-risk projects that NIH won't take on, HHS won't take on, and also, frankly, industry can't take on.
I was interested to hear, the salary situation is different at arpa-h than it is at other agencies too, right?
That's right. So maybe I can walk you through some of the authorities that we locked in. So for our program managers and salaries, I can administratively determine positions. And what that means is we can go outside of the GS scale. I can hire somebody directly. So if we love somebody on a Friday, we can bring them on board on a Monday. We have our Chief Operating Officer, Joe, is here today. This is day 8 on the job for Joe. And once we found Joe and we knew we were going to be a great fit as an organization, as a person, we got him on board very quickly. And we can also be flexible in our salary. So we can hire up to the president's salary. It's like my favorite trivia question. Does anybody know what the president's salary is? No, well, you should go find out.
I do, but I'm going to be silent.
We can hire up to that level. And so it's 400K. And so this is really to attract people to become program managers, because we want to hire these people because they're amazing CVs. They can think and act like a CEO, very actively manage their program, but we're asking them to bring a big problem in health that they want to solve. It's a chance to change the course of your field. And so come in for 3 years. There's this urgency to get that done, and then you can go back to academia or to industry or to government, what you were doing before.
Let's roll back one step, and maybe you can explain it's sort of a bottom-up managing system, which is unusual. And how does that work, and what are program managers? How are they found, hired, and what do they do, and how much autonomy do they have? Okay, I'll stop.
Absolutely. So ARPA-H is a very unique funding model for government. So a lot of people ask me, are you going to fund this? Are you going to fund that? That's up to you all, right? Our ideas come from you responding to our open broad agency announcement, which is live now. So this is a place, if you go to our website, arpa-h.gov, you'll land and find this open broad agency announcement where we want to hear your ideas and your projects that you want us to fund. So that's one way that we get ideas. The other is through our program managers. We're building this organization and hiring these people with a big idea in health that they want to solve. They come in-house once we select them. So the application process is literally, you frame your problem in a set of questions that we've adopted from DARPA, the DARPA model, the Heilmeyer questions. So George Heilmeyer was one of the early directors of DARPA. So it's, what are you trying to do? What problem in health are you trying to solve? How's it done today? What's new in your approach? That's where you bring your technical expertise forward. What are the risks? How much is it going to cost? How long is it going to take? And then what are your milestones for progress? We've added 2 additional questions at ARPA-H, and this is really leaning into the health side of things, which is, how are you going to address cost, accessibility, and user experience? And so this are a lot of product people in the room, so customer and user experience is going to be key at ARPA-H, that we're going to develop devices, therapeutics that people actually enthusiastically want to adopt. We don't want this to sit on a shelf. So program managers, I will not give them a bank account unless they can very clearly articulate how they're going to address that. So supply chain, think about cost as well. And then the last is, how might this program be misunderstood, or how might misinformation be created around these wild new technologies that we want to pursue? And we want to make sure that that isn't what ends up being a blocker for us. We want to make sure we're communicating that. So it's a simple application process, but an intensive for a program manager has to articulate their problem that they want to solve through the Heilmeyer questions. Then we invite them in for a job talk, and if that goes well, they come on board and they hit the ground running. They're going to be there for 3 years. So they have 3 months to launch this program announcement where they look for groups of solvers to solve their program. And then they put a portfolio of solvers together and then very actively manage it. They can add more funds to teams. They can take funds away if somebody's not being successful. So that's sort of how it works. And so if you have a great idea in engineered gut microbiomes, for that to be a program at ARPA-H, we need to have a program manager on that concept. So there's 800 people here today. I ask each of you to think of 2 people in your network who could be a great program manager that is a champion for your topics, and we want to hear from them and their ideas. And that's how we're going to create this flywheel of programs, people, and projects that ARPA-H can catalyze going forward.
Wait, so let's say I'm a program manager and I'm managing a microbiome project, and it's going well, but I'm running out of resources. I can just come to you and say, give me more?
Well, it's not that you're just running out of money. If you see, this happens all the time, you project this 4-year program that you're working on, and 2 years in, there's a new technology that emerges from somewhere else, and you're like, wow, if I had that, I know that this can accelerate better health outcomes if I had this. the program manager will work with you to try to make that happen. If there's a group that hasn't reached their milestones, it's not that it's not great work and they're not successful, but if they're not reaching those program goals, they may not proceed to the next step. So very, very active in that way.
So what you're describing is the thing we always refer to as a sort of moonshot program. You know, take these giant bets and maybe some of them will come true. Can you describe, particularly in the areas of synthetic biology, some of the ideas that might be good moonshot type approaches?
Yeah, I really want to hear from everybody here. We're here all day. We want to hear your big moonshot ideas, but what we did at ARPA-H was we've established 4 technical focus areas. These aren't meant to be prescriptive, but they're kind of areas in health that we think with further investment will really advance the state of the art. So I'll share those with you, and then you can kind of think about how synthetic biology can align with those. So one is health science futures. These are the tools, the technologies, the platforms of the future, whether it's mammalian cell engineering or the next mRNA platform, that can address a number of diseases. So we are a disease agnostic organization. If a program manager has a new platform program, they may bring on a team that's working on Alzheimer's. They may have a team that's working on cancer, but we really want to advance the state of the art for all of those projects. So that's in the health science futures. A lot more fundamental research, I would imagine, happens in that office as well. Scalable solutions. So this is whether you're getting the scale of 10 doses to 1 billion doses of something, lots of synbio opportunities there, obviously, and then the scale of meeting the American people where they're at. So how are we getting things to people's homes that we can actually start to deliver care? That could also be, let's say, through engineered microbiomes, but there's more and more rural healthcare centers that are closing, and so we have to start solving this at the home going forward. Proactive health, just simply keeping people from becoming patients in the first place. So diagnostics, detection, behavior, social science projects that are going to be important. Those are all kind of like product and P-type innovation focused offices. The last office, Resilient Systems, is more of a systems level integration office. And so there's many technologies that are represented in this room today. A lot of them are in silos. What if we integrated them to create a greater whole, and we added a data layer that's machine readable that we can then advance the state of the art? These are types of investments and focus areas that we've laid out.
Well, along those lines, every presentation today has had at least something to do with artificial intelligence. And I'm wondering how you see AI merging with synthetic biology and healthcare. Is that going to be an important part of what you fund?
Absolutely. So, there's a really amazing opportunity that we have at ARPA-H. I like to think of us right now as a minimum viable agency. We just have the people in place to do contracting and HR, and we have a chance to build a data system that is really going to be exemplary for healthcare. It can be best in class in government, and that's something that we want to do really well. And think about if every program that we had machine readable data that's associated with it, that's accessible, that's open access where it's appropriate. This is something that doesn't really exist at scale, and we can build that in from the beginning. Some other interesting innovations, I think, are opportunities to take negative data in some ways. There's a lot of data that's failed around drug trials, et cetera, that kind of remains behind closed doors, right? So what if we can mine some of that data in a way that there might be learnings to advance the state of the art for patients? Again, I'm not going to start programs in this area. The ideals will come from this group. But I think we're wide open on that. And I want to just alert you to another opportunity that's open at ARPA-H right now. We have this kind of unusual situation where Congress has told us you're going to have 3 geographic sites. And by the way, only 210 employees. So we're very lean management. And so how do you use those 3 geographic sites? And we thought about it. There's no 3 geographies that would really represent all Americans. Those are our customers. So we leaned into what we decided to do was a hub and spoke model, where we really use those sites strategically to make sure we graduate programs out of ARPA-H and really access the customers that we need to reach. And so we'll have in the Washington, D.C. region, address to be determined, a stakeholder and operations hub. So we know FDA, CMS have to be at the table. We need to be reimbursed, we need to be regulated. So we'll establish one hub there, but the others are being competed right now. And so what we ask of folks is we have a hub site that's devoted to customer experience. So we want to be able to get to our patients. If we have a program manager that has a pediatric prosthetics program, we want to go to the hub site and make sure that we get a population that's representative of those that we're there to serve. And if we have a in-home geriatric aging in place program, the hub site needs to go out and pull in spokes that'll allow us to work in all these different geographies. Layered on top of this, coming back to AI, I was going to get back to it, was we're going to have a data layer there that we don't have to start from scratch every time we start a program. We can lean into this network. Jason mentioned this earlier. You don't need to start from scratch every time you start a new biological program. We don't want to start from scratch every time we fund a clinical trial or every time we start a program. The system can learn and be a smart innovation hub, and I think I'm excited to see what AI applications will come out of that.
Not that I've ever run a company or anyone would let me, but there are a lot of people out here who are kind of scrappy startups, and I think it's fair to say they often have trouble dealing with the government, but you kind of have to work with the government in these fields.
Yep.
Are you going to make that possible?
Yes, so we have, unique to arpa-h, we have a whole office that's devoted to transition. So if you think about the Department of Defense, you have a missile program, like the DoD is going to make your missiles for you at the end of the day, right? It doesn't exist in healthcare. There's no government organization that's going to make your product for you. So we rely on all of you to be the advanced developers of our platforms that we fund and develop. But how do we make it easier to work with us? And so this office we've stood up, one of the ways we're doing it is through a partnership intermediary agreement. This is government speak for having a not-for-profit third party that knows how to work with small businesses and makes it simple. If you think of a university that has like a grants office, so professor whoever doesn't need to learn everything about the government, the grants office has got it covered. We want this entity to be the grants office for businesses so that we can just make it super simple, very low friction to work with the public sector. This helps our program managers too. So before they launch a program, they can work with this transition office and say, is there a market for pediatric prosthetics? And so they can learn a little bit about that. Who are the investors? Who are the players? So that we're pitching the right program, but learning from those investors, what do we need to de-risk in order for it to transition and survive? Survive in the wild is what our head of our transition office likes to say. And so we're like fiercely committed to things surviving in the wild through that transition office. And so we want to hear what the investor risks are because the arpa-h can help de-risk that.
Can you, in maybe slightly more detail, explain the decision-making process that would go into one grant, one program? I mean, are you the ultimate decider? Is it a panel?
It's very lean. There's basically two approvers. So the program manager will first develop their concept and pitch it to the mission office director in those 4 focus areas that I mentioned. That's the first green light, and then it will come up to the director's office. We have a S&T board that provide their perspectives and review and kind of give their suggestions, but ultimately I'll decide if the programs go forward or not. And so with that really lean decision-making structure, it also lets us take those risks. I should say, and we talked about this in the green room a little bit, we're established within NIH, but I report to Secretary Becerra, and so and he's the head of HHS, and that was a really important piece of this, so that I could take those big risks. We have a wonderful partnership with NIH, like world experts in so many places, but they won't be a gateway to the decisions that arpa-h makes.
I'm wondering if you're worried at all about, so you have these truly great ambitions, but I look at some of the moonshot industrial proposals. It's like Google X. It's all moonshots. Some of them have sort of worked, lots haven't, but it's a private company. So, no congressman is going to be running in and screaming at them, or at least it won't matter if they do. You're in a different situation. So how do you, what does success look like for you?
Yeah, so we have engaged a lot with Congress, and I ask 40 members of Congress I've engaged now to explain what this is and set expectations, and I ask them what success is. and to them. And what's really interesting is we have unanimous bipartisan support because everybody has an elder parent that has Alzheimer's disease or a child that has a rare disease. Health touches everybody, and so I was very pleased to find out that everybody wants us to be successful. But what success looks like is different to folks. I think for us in the near term, success is getting our authorities so we can make decisions, and so we've done that, really excited. Hiring the right people. We need to have a portfolio this year. The 20 program managers that I hope to hire this year should represent 20 totally different projects that really start to unlock the imagination of what ARPA-H can catalyze. And 3 years from now, it should look totally different. That will be a success for us. If we have 400 cancer projects, we failed. If we have some cancer projects and some technology focus, that's a success. And then, this is gonna sound maybe a little funny, but success will also be if we fail. We have to have room to fail. That means that we're taking those moonshots. We want to be very transparent in those failures, and learn from them as we go forward. So yeah, hold me to that. Let's talk in a year or 2 years from now and see how it's looking if we're hitting the right note.
Oh, I'll hold you to it, don't worry. I'm curious, speaking of that, what happens, I know that it's an established agency, but it's established by a political individual called the president. What happens if there's a different kind of president?
Yeah, so, starting with that unanimous support, the Congress has given us $2.5 billion appropriation. The president's just asked for another $2.5 billion for us. I think that will continue because the new solutions in health are needed. Whether I'm at the helm or not, in our authorities, I have a 4-year term to start, renewable for another up to 4 years, but ultimately the president is a decision maker on that. But I'm confident that the agency will remain. It's just how does that leader change over time?
What are you looking for in a program manager? I mean, you're talking about, is it someone who focuses on cancer biology for one thing, or a broader, I'm not really sure.
Yeah, it could be. So we're looking for folks who are an expert in their field, whatever that field is, or that willingness to totally reinvent themselves and jump to another field, right? Like Tom Knight is a great example of someone that's just all right, I'm doing this, because I'm really passionate about what can happen next. These people are not afraid to take risks. They're decisive. You're only there for 3 years for the first term, so that means every 2 weeks that goes by, 1% of your time has elapsed at ARPA-H, and so there's an urgency, so people willing to move quick. And then I think people that are good listeners, so you're never gonna you're not gonna be a patient in everything, so you need to be able to listen to those patients, those healthcare providers, industry, about what needs to go forward in the programs. And then these people can be early career, they can be mid-stage, they're tired of the status quo, they want to come in and change the course of their field and then go back and continue their work. Or they're late career stages that have just see the problem so clearly, they're not afraid to take a career risk because this might be the last step. So any of those are all possible, but we're looking for diversity of demographics, geography. We're not making anybody move. We're looking for a variety of projects, as I've mentioned, but also experience. Have they been in government? Have they been in industry? Have they been in academia, or all three? We really want to have a good mixed group in that regard.
Are you the person who ultimately hires the program managers? Do you have a team that votes, or? We have
a team. We're building a pipeline, and this is something we're doing a little bit different than DARPA. We will be hiring today. We'll be hiring a decade from now because of this flywheel, and so we really want to give ourselves the best chance of recruiting. And so we're setting up a good pipeline. The mission office directors guide a lot of that, but we're going to have a team to help do some of that recruiting and outreach. Especially we're just starting out, minimum viable agency. That's the hardest part is, bringing these folks together, getting their $1 million idea to a $100 million idea takes a lot of time.
I won't ask how different you are from DARPA, but I think a lot of people, when they hear about you, are going to say, it's DARPA for health.
Yeah.
How wrong is that approach?
We're adopting the business model, but it's not a copy-paste. So I talked a little bit already about our transition office, which is definitely different. For this group in particular, I do want to flag one of our authorities is, I think it's going to be magical, and I can't wait to see what we're going to do with it, which is we can reimburse FDA directly. And so NIH does not have this authority, and that means that we can incentivize industry in non-financial ways to work with us. And so I've been working closely with the commissioner's office on, like, how do we define that? Is this, what does this look like in terms of funding, platform technologies, having a different approach to regulation there? We want to hear from you about what would be most empowering for your organization. So on Monday, we released a request for information where we've listed a few different types of ideas that we have that might be things, tools that we could use, but we would really love to hear from industry. Like if your technology is amazing and the regulatory piece is a challenge, to be clear, we're not going to reform the FDA. That's just like off the table. That's not what arpa-h is going to do. But what are the creative incentives that you'd be excited about?
Before they come out with a hook, is there anything specific left that you want to make sure everyone knows?
Just that we're here. I think that the health sector and SynBio maybe doesn't know what arpa-h is about, and I hope we've helped demystify that a little bit today. We're really excited to work with the SynBio community. I mean, one of the reasons I went back to government is because I'm a big believer this really is a century of bioengineering, biotechnology, and let's harness these tools to better all of our health. And we're really excited to do that in partnership with all of you here.
Well, we're very excited to have you doing it. Thank you very much for the conversation.